hand up already. I don't know if that is to ask a question or if that's... Your initials are RB and your hand is in the air.
Oh, sorry.
That's all right. So we're practicing putting our hands up. So obviously, if you do want to raise your hand, then there's the icon at the top. You can unraise your hand by clicking on that as well and put your hand down if you want to. So for those of you that don't know me, I'm Dr. Glenda Beard. I'm a GP in Bristol and I'm the clinical lead for cancer at our Integrated Care Board. Really passionate about every aspect of cancer care, but particularly around early diagnosis of cancer. I'm joined today by Georgia Deeble, who's our senior primary care facilitator, who's done lots of brilliant work across practices and been integral in setting up this webinar today. So thank you, Georgia, for all you do. But we have been joined today by colleagues from Copperfield, an amazing charity doing brilliant work around sort of breast self-examination, breast cancer awareness. So I will hand over to Emma, who is going to share, we are hoping, slides from her computer to take us through. Emma, you can let people know if you want to have sort of questions throughout or sort of questions at the end. It's up to you.
Thank you, Glenda. I think at the end, if that's okay, but if it helps to remember, if you want to pop them in the chat, and perhaps we take some time at the end to go through everything. Yes, thank you very much. Good afternoon. It's a pleasure to join you today. And in a moment, you should be able to see, first of all, just our very bright pink charity logo coming up on your screen. All okay?
Yes, it's there, Emma. Thank you. We can see it.
Okay, thank you very much. Right. So I'm in the education team. I'm the health information manager here at Copperfield, and joined by our health and services assistant Harini today as well. So I'm going to cover a few. Well, here's our lovely me on one of our fundraising treks. Working at Copperfield involves a lot of glitter and talking about a very serious issue and message in a bold way, really. So breast awareness for healthcare professionals. This is part of our webinar offering to healthcare professionals, and it's fantastic that we can put them on a bespoke basis, much like today, and really hope that others see the benefit of having a talk from us, really, all about breast awareness and our mission here at Copperfield. And a good afternoon to you. I hope this captures everybody here today, and more than happy to follow up another time. If there's anybody that missed the live version today, we can, of course, arrange another session another time. And the objectives of today's session, so our core learning objectives are to recognise the benefit of early diagnosis in breast cancer. So we are a breast cancer awareness charity, which I will touch on in a little more detail in just a moment. Distinguish between breast awareness and breast self-examination. So we promote breast awareness, so I'll give some context to that as well. A refresher on the signs of breast cancer. I am, of course, aware that talking to many people with many different backgrounds, whether it's a clinical background, a specialism, but always good to kind of show how charities like ourselves are explaining signs of breast cancer, particularly for our audience who are young people aged 18 to 24, and identify common breast cancer misconceptions. There's a lot of information out there about cancer, breast cancer, and there's a lot of myth busting, if you like, that we do here at the charity. So I'll cover those as well, and time at the end for any questions. But as I say, if you think of something along the way, perhaps pop it in the chat so it's there and we can come back to those at the end. Okay, so a quick poll, which Roger's very kindly helping with, and that's where you'll need to have a look in the chat now, actually. Just one question. This is anonymous. It just helps inform us around confidence levels having breast awareness conversations with your patients. So it should just appear as one question there. I think we're all good. Yeah. So if you could take a moment, as I say, it's always anonymous. There's no judgment. If anything, if you're not very confident, hopefully hearing from us today will help increase your confidence levels, because we really value our work and engagement with healthcare professionals. You are key people when it comes to having awareness conversations with young people. So we'll give it a minute or two. Sometimes I am known for slightly rushing through the polls, and appreciate sometimes it's just take a moment to reflect and pop one response in there out of the multiple choice options. So we'll...
You've got 24 responses so far, Emma.
Oh, wonderful. Thank you. That's good. Thank you very much. Should also acknowledge, you know, our gratitude for you joining on your Tuesday lunchtime. Very much appreciate you dialing in to hear from us.
Okay, I think we're almost there on the poll for people
Great.
putting response in.
Lovely.
Thank you, everyone.
Thank you. Yes, much appreciated. So that's our kind of starting point. How confident do you actually feel about having these conversations? It can be quite a challenge, can be quite difficult. It's thinking about those points of contact to raise, whether it's a body awareness conversation more broadly, or awareness as in chest checking, which is what we encourage. And you may hear me refer to chest throughout. We gathered insights from young people, and chest is reflective of all bodies and gender. But of course, when there's a clinical need, we refer to breasts and breast awareness, breastfeeding, breast cancer. So a little on who we are. You may have heard of us already, and obviously we had an incredibly busy month in October with it being Breast Cancer Awareness Month, but we of course would like everybody to be aware of breast cancer and be educated on breast cancer every month. But we are the UK's only youth-focused breast cancer awareness charity. Began in 2009, so we're 15 years old this year. We celebrated our 15th birthday, so we're very much teenagers now. We're on a mission to get every young person checking their chest, and by driving this behaviour, we will save lives. And we target 18 to 24-year-olds, and we engage very closely with healthcare professionals. So webinars such as today, we have healthcare resources, all free of charge, and everything to support you in your role. We completely understand there are, you know, many competing priorities and time pressures, but if there's something just there to signpost and to initiate that 1 or 2 minute conversation, it really lands with young people. We know that they listen to and engage with trusted sources of information like healthcare professionals, looking at NHS information and guidance as well. And I will cover some of our statistics in a bit more detail later on. So we were founded, as I said, in 2009 by Chris Halenga on the right in the mermaid sequins, if you like, in this picture, and her twin sister Maren, after Chris was diagnosed with secondary breast cancer at the age of 23. She visited 3 GPs with symptoms varying. Yes, this was, 15 years ago. She was finally referred and diagnosed. At that point, it was secondary breast cancer, so it had spread from that primary site of the breast. At the time, Chris was unaware that breast cancer could affect people in their 20s and knew very little generally about the disease. She was struck by the limited information available for young people, and so the idea for Copperfield was born. And the idea was a charity dedicated to better represent and reflect young people's experiences of breast cancer through education, awareness raising, and empowering young people to have agency when it comes to being proactive about their health. And at this point, as you may already know, but very sadly, Chris died in May of this year. And our mission very much continues with her in mind. And we want to continue to raise awareness across the whole of the UK. So that is us. And in terms of that mission, we focus on encouraging people to be confident chest checkers, educating them on breast cancer, on the signs of breast cancer, and empowering them to go and seek advice, go and speak to most likely your GP, first of all. Empowering them to go and seek the right advice is very important as well. We are making sure that we're a trusted, reliable source of information. And that comes through things such as our patient information forum, or PIF, tick accreditation. So every year we submit our information and make sure we can showcase that we're meeting their criteria for trusted, reliable health information. Okay, so moving on to breast cancer itself and some statistics that we often refer to in our work and in our resources. At the moment, it's 1 in 7 women in the UK will be diagnosed with breast cancer in their lifetime. As an awareness and education charity, we source our statistics again from reliable sources. So common places, the majority of our statistics are from Cancer Research UK and Breast Cancer Now, and NHS as well. And again, some more UK specific statistics. Around 2,500 people under the age of 40 and nearly 400 men are diagnosed with breast cancer every year. So we're very mindful of making sure our message is for everybody. We create a community, if you like, of people often sharing their story of being diagnosed at a young age and encouraging that conversation around checking, talking to family members if there's a strong family history, for example, making sure that you're confident to tell your GP if you are presenting or you've noticed a change. It's important to tell them about any a strong family link there in terms of breast cancer. But while we know incidence rates are higher with age, we are really focused on 18 to 24-year-olds in the hope that by developing a healthy checking habit at a young age, you take that throughout your life. So when you reach screening age, for example, and when perhaps your risk is higher due to age and other factors, but you know the importance of being aware of your body, knowing what is normal, and knowing that it's important to go and seek medical advice if you notice any unusual changes, and do that promptly, which is what we mentioned at the start. There's a real focus on that early detection and early diagnosis as well. Now, we work with a research organisation, so we carry out our own research here at Copperfield, and it's useful to see really, but of course identify the fact that these numbers need to improve really. We would love to build on this because the latest research is telling us that 29%, so in that diagram we've rounded up to 30%, 29% of 18 to 24-year-olds check their chest at least once a month. 54% of that age group say they feel confident starting to check. And then knowing you're normal, 57% agree with the statement, I'm confident I know what is normal for my chest to look and feel like. And 61% are confident in noticing a change. And then lastly on this slide here, the relevancy piece. So 39% of 18 to 24-year-olds say they feel there is little chance of getting breast cancer now or in the near future. So there's work to be done, and that's where, of course, we are targeting the young people themselves, but of working very closely with healthcare professional teams to make sure people feel confident having those conversations and encouraging the checking behaviour really, so that hopefully that 30% we can start to fill this chart a little more, and that percentage of young people checking once a month, so on that regular monthly basis, increases really beyond 30%. So let's see what we can do over the next few years. And thinking again about early detection and early diagnosis, I will give some context to these. These are taken from a version of this webinar, essentially. It's on our learning hub called Copper College. It's also on the NHS, well, it will be very soon, it'll be on the NHS Learning Hub. So if at a later date you wanted a bit of a refresher, you can go back in there, but I'm aware today's session will be on your own training hub as well, which is fantastic. So on the left there, the stage 1 and 2 graphics, if you like, in the pie chart are talking about, so I'll cover this in terms of how Cancer Research UK talk about early diagnosis. So they have, if you haven't looked already, it's an interesting resource really, the Early Diagnosis Data Hub, and you can filter by cancer type, you can filter by country within the UK, possibly even region as well, I think. But 5-year breast cancer survival in England, currently stage 1, actually this is on the right, sorry, the bar chart, 98%, 98.2% of people will survive 5 years when diagnosed at stage 1. Stage 2 is 89.5%, and stage 3, 72.2%. Stage 4 that we've put there in the green, it reduces to 26.2%. So really important to identify that early detection, early diagnosis. And we know breast cancer is the most common cancer in the UK. So of course, many people are affected, but if found early enough, as you will know as well, the survival rates are higher, as shown here, and the treatment options are a lot better. The pie chart, in fact, is representative of, so kind of comparing cancer sites there, that's relating to lung cancer, which we know, of course, outcomes are a lot poorer even when diagnosed at that earlier stage. I will just briefly talk through, because from that same early diagnosis hub, this is for cases diagnosed in 2016 to 2020. That's for the 5 years, and with excuse me, I've got a bit of a dry cough today. 2007 to 2017. Excuse me, just a short water break. Is for the 10 years. 10 years survive breast cancer survival. Just going to pop a bit of AC on. Is that right, Helen? Apologies. So stage 1 is 96% will survive 10 years or more. 79%, 79.1, sorry, will survive 10 years or more at stage 2. Stage 3 is 52.7, and at stage 4 it's 11.6 10-year survival rate for breast cancer. And just as I've mentioned, early detection is the best form of defense. So we talk about it in that sense in our messaging, in our comms, to explain to young people that if, you know, that's why it's so important. If you notice an unusual change that could be an indicator of breast cancer, not necessarily, it could be something not non-cancerous, but it's really important to go and get checked out. So if in doubt, get checked out is one of our kind of key strap lines as well. So our breast awareness message, we are encouraging that broader awareness as opposed to self-examination, purely because the self-examination is a little more prescriptive, and there's insights to say that it in fact causes some level of worry, and in fact people don't necessarily engage in the behavior because it feels a bit unknown, and there's a lack of confidence to kind of get started. So a bit more broad in the awareness sense, in the breast awareness message. And there's key points to look and feel. So we know that breast cancer is a symptomatic cancer, so there may be signs of it that you would see through that checking monthly by looking at that chest area, but also that by feeling the chest area. So with the lump being the most common presenting symptom, but of course there are others, it's important to spend the time looking and feeling, and that's the whole breast tissue area. So checking all breast tissue under the armpit and up to the collarbone. Many of our supporters are not necessarily aware that we all have breast tissue, so we are talking about everyone here, all ages, all genders, all ethnicities, and to encompass the full armpit and collarbone area when you are checking. While we'd like to see more insights on monthly checking being the best sort of time frame to recommend, we like to encourage that monthly checking because it's a point in time that everyone can everyone can do it monthly. We previously used to encourage regular checking, but through our health literacy auditing and health information review, it was found that regular is quite a broad and challenging concept. One person's regular could be every 2 months, and somebody else is almost every other day, and we don't want to kind of stray into health anxiety and prompting too much time spent checking and worrying that you might be finding something that's breast cancer. But every month, and that aligns with our behaviour change tools, such as our free text reminders. So on the 1st of each month, we don't necessarily say you have to check on the 1st of each month, but there's a free text message that comes through in the form of a rhyme or a poem to say it's time to check again. There's that prompt. We all have very busy lives, but it's important to do it to make sure that you know what is normal. There may be some lumpier areas or differences in size, but if that's your normal and it's there every time, you are aware of that. It's only when something is new and unusual that it's then time to go and seek advice. And as it says on number 4 there in the messaging, get to know what is normal for you. Everybody is different and will look and feel slightly different, so get to know your own normal. And really important that we highlight, it's not about looking for cancer. So we're very mindful in our messaging and our communication that we're not saying look out for the following or look for these worrying signs necessarily. It's about that body awareness, getting to know your chest and what is normal for you. The next, let me just see, okay, that's fine. So I'll take you through briefly. That's where we're sort of embedding the breast awareness message in that smaller text, where you can see we outline what you can see is as important as what you can feel. So remember to look and feel when checking your chest. Where possible, we refer to signs of breast cancer. Signs are easily understood, and they are actually signs as opposed to symptoms at that point in time. Sometimes with search engine optimization, it's better to include both words, but there's always method and there's a reason behind our choice of wording and our placement of information as well. So we include these on our information resources and let people know that you don't have to memorize everything and kind of make sure this is ingrained in your memory. Just refer to the existing resources for that prompt, really. So skin changes such as puckering or dimpling, which can look similar to orange peel, unusual lump or swelling in your armpit or around your collarbone. These have been updated this year, so we've had a very busy year as a charity with our brand refresh and health information updates and review as well, and also health literacy. So the average adult national reading age is 9 to 11 years old. So we've really factored that in. For example, so we've got unusual lumps and thickening there, but nipple discharge, we've changed to liquid coming from your nipple. So liquid that comes from your nipple without you squeezing it. And we've had input from clinicians and young people themselves. So we held focus groups looking at these icons as well, and trying to depict all different skin tones in our icons and body shapes as best we can as well. A rash or crusting around the nipple, and yeah, we cover that in a bit more detail as well, referring to skin tone. And nipple inversion, we now refer to as nipple is pulled inwards or changes direction. Unusual or sudden unusual change in size or shape. Constant unusual pain in that area as well. And then I've just added the copy that we, where possible, when we have more space, for example, on the website, we explain the colour change in skin as well here in a bit more detail. So lots of reasons why the skin could become irritated, especially during breastfeeding. Get it checked out if you notice a change in colour, a rash or crusting on or around the nipple, and your skin tone may make a difference to how this looks. So on black skin, the area may go darker than the surrounding area. You may notice small spots in the area. Sometimes you can notice changes in colour, such as purple, yellow or grey. On brown skin tones, redness may be more maroon, so brownish red. Again, best practice for us, and I know this happens in NHS messaging as well, but explaining a lesser known word or term or a more complex clinical word, putting the brackets there to explain it in the most straightforward way as well. So brownish red for maroon, and the area may go darker than the surrounding area. On white skin, this may look pink or red. So that information is on our website and came from a clinician as well. We wanted to acknowledge that purely referring to redness, it doesn't reach everybody. So we've got to acknowledge that these changes may look different depending on somebody's skin tone. And thinking about health inequities, we have priority groups here at Copperfield, and we refer to inequities because these are avoidable factors as opposed to health inequalities. We are looking at factors that they are very complex, but we can address them. So there's significantly higher proportions of Black African and Black Caribbean women diagnosed with breast cancer at stage 4 compared with white British women. Black and Asian women have been shown to have a lower awareness of breast cancer signs and less likely to carry out health-seeking behaviours, more likely to delay seeking help, and may experience further delays post-diagnosis. While diagnosis of breast cancer in pregnancy is rare, pregnant women diagnosed with breast cancer are doubly likely to be diagnosed at stage 4 than the general population. And research for our LGBTQIA+ people is limited, but the charity Outpatients, I would definitely recommend looking at their information. They've identified that trans individuals report poorer health and a higher instance of late stage diagnosis due to healthcare access issues or avoidance. Sources are listed there below. Happy to forward those as well. But that really informs our work here. We want to address these health inequities. So when we are developing our information and our campaigns and our resources, we are considering this. It's very considered here, and every project we want to make sure it's reaching as many people as possible and addressing the balance really, but doing that through asking people, particularly young people, so increasingly co-designing and co-developing projects and campaigns so it's in their voice and it's not necessarily just the way we think we should convey that message. We want it to land with people. We want it to be culturally sensitive and appropriate as well. So for example, recently we collaborated with Amalia, a Muslim women's organisation who created some information and social media content with us, but very much in the most appropriate way for their audience. How are we doing? I'm okay on time. Yep, I think we should be just about on time. That's great. So I'll briefly cover these. I was meant to put them as the PowerPoint effect where they flash, they appear, but apologies, I've not made it quite as exciting for this slide. But facts around breast cancer, as we've mentioned these already, but the 2,500 people under the age of 40 is a key stat for us here. Incidence rates rise steadily from the ages of 25 to 29 and more steeply from 35 to 39. These are from Cancer Research UK. A lump is the most common presenting symptom. A malignant lump is usually painless, but discomfort can occur. And the stage 4 diagnosis more likely in pregnant women and Black women, despite less incidence among these demographics. Some of the misconceptions, there are more emerging, or there's more concerns about particular lifestyle factors, things like ultra processed foods, sunbeds. There's lots of questions around those from the school talks that our volunteers deliver. But we know there's no evidence around 5G, implants, deodorant, or the wrong size bra. No evidence that these are linked or can cause breast cancer. Breast awareness causes overdiagnosis, not the case. Recent investigations in the chest area would pick up breast cancer. That's not necessarily the case. And we do work very closely with Breast Cancer Now, who are research and support. But when thinking about encouraging people to attend screening, they do a lot of work in that area, but encouraging that awareness between screening appointments as well. If you have cancer, you feel different. That's not necessarily the case. And there's sometimes a misconception that a lump is the only symptom. So making sure people are aware of the others, and only older women get breast cancer. We know that is not the case. And of course, our founder, Chris, was incredibly young at 23. I'll briefly again sort of touch on genetics and risk factor. So no one in my family has breast cancer, so I won't get it right. Well, we explain this in our, again, when thinking about reaching young people where they are, we explain it as gene changes. So we say we have all have genes which are inherited or passed down from our parents. So I'm using the wording that we use. This includes genes that protect us from cancer, including the BRCA genes. BRCA standing for breast cancer, so the BR and CA, BRCA1 and BRCA2 being the most common. These genes correct any DNA damage that naturally happens when cells in the body divide. Some people inherit a changed BRCA gene. So this again came through the health literacy insights to say that mutation is a difficult word. Let's call it a changed gene, but it's important to let people know that we all have the genes. It's when there's that fault or that change that's when your risk is higher. So when it's changed, it may not give the correct instructions anymore, meaning the genes cannot repair damaged cells, and therefore these could form a tumour. But having the changed BRCA gene doesn't mean you have breast cancer. It means your risk of getting breast cancer is much higher, and between 50 to 90% higher than someone without the changed gene. But important to obviously note that, again, through cancer research, it's between 5 to 10% of cancers are caused by inheriting a changed gene. So unfortunately, it's not always linked to genetics. As you can see there are many other factors, and sometimes, of course, with cancer itself being 1 in 2, it's sometimes just a very unfortunate thing that has happened. So looking back to breast cancer and the NICE guidance on referrals. So you've got that on the right of this slide. Bearing in mind that we've in England, of course, moved into the faster diagnosis standard from the 2-week wait pathway, but there's the referral guidance on suspected cancer referral if the person is age 30 and over with an unexplained lump with or without pain, or if they are 50 and over with any of the following nipple changes, so discharge, retraction, any other changes of concern. Consider a suspected cancer referral pathway for breast cancer in people with skin changes that could suggest breast cancer, or age 30 and over with an unexplained lump in the axilla, and non-urgent in people aged under 30 with an unexplained lump with or without pain. But we of course would urge you to listen to the person in front of you, listen to your patients. We of course encourage young people to go and speak to a healthcare professional, and we would ask them to be prepared. So writing down when they first notice changes, again, asking it within your family if there's a link there, if there's many incidents of breast cancer. Remain open-minded and consider every case individually, and don't dismiss due to age would be our ask to all healthcare professionals. When a young person has often gained the confidence to go and get that advice and go and have an appointment with the healthcare professional in the first place. So a lot of work around supporting young people to go and speak to their GP. So there are a few threats to the mission and the awareness raising, really, which is why conversations with patients are key. It really can be that starting point for a person to leave the appointment or the clinic and think, yes, this is important. A healthcare professional has encouraged me to do so. There's lots of misinformation with the growing presence of social media and various platforms for people who don't have the qualifications, or they're not really clinicians, but they're putting information out there, or talking about their approach if they've been diagnosed. So sort of finding a way through that information, which is why, again, talking about the fact that we're accredited, we are a trusted, reliable source, we work closely with NHS organisations and other charities, and we know young people are looking for that correct information. So it's making it sure that once we've got informations and campaigns, it's finding the best way to reach as many young people as possible with it. Myths about breast cancer, so again, so addressing those, addressing health anxiety, so doing a lot of work, and increasingly we're going to develop things like our video explainers and video guides, of which there'll be actual healthcare professionals to show young people then doesn't need to be a scary or worrying experience. You will go and speak to a person who will listen, and but you can be in the best possible position and be prepared for the fact that sometimes, you know, there's a very short amount of time that you're allowed with that person. So make the most of it. Take your list of questions or concerns with you and have that ready to address. And previous negative experiences. So again, building or rebuilding that confidence to go and speak to the healthcare professional. So common settings to have a check-in chat, if you like, with patients. There are probably more than these, but contraception appointments, reproductive and fertility appointments and discussions, any postnatal appointment, even asking the question and then signposting, for example, to some of our information or resources, cervical screening, lifestyle behaviour conversations, school health, and we do work with school nurses, sexual health clinics, practice nurse appointments, CNS appointments, and disease self-management. So lots of opportunity, and it's probably a good point just to spend a moment thinking about any or all of these that could apply to yourselves, and making a note to include a chest chat at your next appointment. You don't have to say, I'm about to have a chest chat with you. It's quite difficult to say sometimes, but have you been checking? Are you aware of the importance of checking? And then a signpost to us. Literally in 1 minute, it can really make a huge difference. And there are tools to signpost to. So we have a web app called the Self Checkout. As it says on there, it's a 2-minute check-in tool, if you like. Can be accessed on mobile or on the web, through the website. And again, very inclusive messaging. So at the beginning, a young person can select their preferred terms for the chest area: chest, boobs, breasts, pecs, and that will be carried throughout the checking journey and the user journey. And at the end, you can set your own reminders. So there will be the option for the monthly text reminder that I mentioned. There's also calendar and email reminders that you can set once you've gone through the stages of the self-checkout. Other information and resources, it's all free from us. Order as much as you like. We are very happy to kit you out with everything you need to have these conversations. Here's an example, a snapshot of them. So this is an example of what would come through to you in the post. So you just fill in a brief form, which we can circulate after today, and you request a healthcare pack. So just put the preferred postal address, and you've got posters on there, the pregnancy booklet, which we developed with Tommy's, the charity, outpatients that I mentioned. We've developed a poster series with them using fruit imagery, so it's a little less gendered, and things like our shower stickers, which are waterproof. Pop them on a mirror or in the shower is an ideal checking opportunity. So do request these, and we can happily keep replenishing the stocks as you need them. There is just a couple more slides, so it should be finishing at pretty much 1:45, I think. Yeah. Just wanted to highlight and showcase our work with ANSAR projects and ORCID here. So learning disability organisations. You can access these through the Thera Trust website, which we'll signpost to again after today's session. But we developed the Know Your Body series in collaboration with them. So it includes things like a body diary for a person to record their checking, and also an adapted version of our checking card. So you can see there's a clear call to action really at the top to look, feel and be aware. And the wording and messaging was developed again with their experts as well to make sure it's as accessible as possible. So to book a doctor's appointment if you notice any of these symptoms, and the information is on there for them. So Thera Trust, which again we'll signpost to all of these, anything I've mentioned today we can send the relevant links to. And the pregnancy booklet developed with Tommy's, that's a really useful resource as well, because it talks about natural changes that happen during and after pregnancy as well, but does highlight that you do need to be aware of the following, and the signs of breast cancer are in there. So it's to help people understand the changes and what's going on at that time in life. And if you know what your breasts are usually like, you're more likely to notice any changes, which we've mentioned is called breast awareness. They can change a lot when during and after pregnancy, and it can feel confusing to get to know them, but this booklet will help people to better understand your breasts and their breasts and feel more confident about checking them. So all this can be accessed as a digital resource, but again also as a printed copy which appears in the healthcare packs. And they're in situ if you like, but examples of the outpatient posters, we'd encourage those to be placed in relevant settings as well. So how we can support you, hopefully I've covered quite a bit there already, but just to reinforce that all of our training courses and things like these webinars are free, and the training module is just being checked by the NHS team in terms of tech and that side of things on the NHS Learning Hub, Copper College as well, and the healthcare packs that I mentioned are all available to you. And make every conversation count really. Ask young people if they check, and signpost at Copperfield would be wonderful. And that brings us to the next poll. So if we're okay to launch that one, so again it will be in the chat, and we'll have just a minute or so to complete that one. So it's the same question, but just reflecting, having spent 45 minutes or so together today, how are your confidence levels now? Are we getting responses?
We are, Emma. Yeah.
Thank you, fantastic. And there's just one more, and then there's a Q&A slide. But give you a second to do that one. While you're doing it, actually, I will just, my final ask from you is, of course, we're all role modeling, and we're modeling this behavior to young people, whether that's young patients or young people in our lives. So I would have asked you to check your own chest, whether it's today or sometime this week. Please get to know your own body. We spend a lot of time giving this information and the support and the guidance, and in your clinical roles you're giving advice and referring people, but take a moment to actually check yourself, and it could just save your life, as we say here at Copperfield. So that I will keep the poll going until I think maybe we'll just wait for a couple more people. That will lead through to Q&A, so I'll stop screen sharing in a moment, but a huge thank you from me for your time and for engaging with us. We do really appreciate it. And as I say, we're more than happy to organise another session in the new year, next year, 2025, if that's something you would like. And keep in touch with us. We have things like our healthcare monthly mailers as well, so our emails, and that will let you know what we're up to and where we are in terms of going to various healthcare conferences and events as well. So thank you very much. I'll stop sharing. Oh, thank you. There's some applause. Very nice.
Oh, it's nice to have applause, Emma. Thank you so much for sharing all that information, and really positive to see the kind of growing confidence and health messaging about for yourself, for your family, friends as well. And think about these people, not just people we come to contact with at work. Roger.
Thank you. Just a quick bit of housekeeping. We've got the feedback form in the chat, so please use that link to give us feedback so we can gauge how good, bad, or indifferent it was today and improve for the future. That's really useful feedback for us. Thank you. And I've also, a few people have dialed in, not from their main
Roger,
email.
excuse me, interrupting. We've got 2 more speakers. 2 of them are the
Oh, beg your
speakers
pardon.
for the last bit.
I
So
beg
we'll
your
go
pardon.
back to Glenda.
I'll be quiet.
Okay.
Thank you.
Thank you. No, it's important to plug that the feedback is there. So really positive to see the response to the polls as well. I was going to ask a question, but maybe we'll come back to it. But in terms of people who've selected fairly confident, what do we think we can get people over the edge to that sort of very confident? I think that would be really helpful to pick up in the feedback. Thank you. I'm going to hand over to Georgia to invite her to introduce her other speakers. Thank you, Georgia.
Thank you very much, Glenda. So thank you, Emma. That was a great overview of what's so important about breast awareness. Just to complement that, earlier in the year, we had a breast screening session for non-clinical staff, which is available on our library in our resource hub. But we've invited the Avon Breast Screening Unit team along for a short presentation now, just to sort of give the whole picture around screening and the services available locally. So I know Naomi and Syrian have joined us. I can't see you on screen because I've got a lot of people there. Are you there?
Yeah, hi.
Yes.
Hi, Georgia.
Hi.
We're both here. Hi.
Thank
Sorry,
you.
my internet isn't great, so the camera tends to go off. But yeah, we've got a very quick presentation to show you.
Wonderful.
Just a little bit about screening, basically. So hopefully, can you see that now?
Yes, that's wonderful. We can see
Great.
your slides.
So I'm Sarian. I'm the program manager for Avon Breast Screening, and I'm joined by Naomi, who's our lead CNS at Avon Breast Screening. We're both fairly new to post, but old hands at breast screening. So we're just going to give you a bit of an overview of the program, its background, a bit of the coverage and locations, the way we plan and invite, and how you can help us support your patients. We began in 1988, so we've been running a long time. We screen women between the ages of 50 and up to their 71st birthday, so slightly different cohort to what to the one Emma was discussing. But the earlier we can get breast screening into people's minds, the better, I think. So we nationally invite 1.73 million women a year with 1.3 million uptake, and we diagnose approximately 10,000 breast cancers per year. So obviously we started 33 years ago, and in that time our eligible population has grown hugely. And in the BNSSG, we currently screen 180,000 women. And as you can see, our numbers have grown from 90 diagnoses per year to over 400 now. We're based at Southmead Hospital. This is the hub where most of our assessments following screening happen. We're a massive team of 60, from admin to radiologist, the breast care nurse specialists, and the radiographers. And also our surgeons are also based at the hospitals in the area. We screen a massive area, everywhere from Thornbury down to Frome and across to Weston, and of course Bristol as well. So this is one of our mobile units which we take around. We have 3 of these. They're the ones that go into the community to try and reach as many people as possible. We have a very old central site at Tower Hill, which was our original site until we moved up to Southmead Hospital and our state-of-the-art facility, where we do all our second looks now. So the screening program runs on a 36-month round length, what we call the round plan. We invite all women between 49 and 8 months to 70 years and 11 months every 3 years. And we are monitored. We have to screen over 90% within those 3 years. What we do is we have a list of each GP practice, and we call all the women from each GP practice in turn. And we have to be really aware of change in populations, GP mergers, availability for sites, staff shortages, all to manage basically screening your GP practices at the right time. We manage this by planning continuously with the staff in the unit, prioritizing locations and looking at rotas to adjust this. We have an antiquated system called the National Breast Screening System. It doesn't speak that well to GPs at the moment, but hopefully in future we'll be able to show a new system that we can directly send you GP reports. At the moment, we send you a mass of paper regularly, which I'm sure all of you really dislike. We also use something called BS Select, and this is basically how MBSS talks to the spine. And again, that is still improving all the time. But yeah, we're quite limited. So our system doesn't talk to a hospital system, and it doesn't talk to a GP practice system either. And we're hoping that in future that will change so we can basically talk to you. So we do everything in-house. It is a national program, but each individual breast screening does its own round plan. So as you can see there, it's quite simple. This is a round plan. It'll show you your practice, when you were last screened, when you're due to be screened again, and your cohort. We build our own clinics. We book several practices at any one time to the 5 locations we do. We use the round plan and we decide what practice to book, where and when. Obviously, it's quite a lot to maintain, but I think we do it quite well. So we did have a few slides on what a mammogram is, but as Emma's gone over a lot of all of that kind of thing, we didn't put that in this time, but there are a lot of questions about mammograms that we get from 50 to 70-year-olds. So I think this slide would be useful for you to keep because you may get those questions later on. And what can you do to support us with the breast screening program? We have loads of leaflets, posters, Facebook page. Please like and follow us. We are trying to increase our uptake all the time, basically. We do a lot of work with Georgia, and the breast care nurses go out into the community to try and promote breast screening. One of our targets in the future is increasing the uptake, basically, with those that have never had breast screening before. So those 50 to 53-year-olds, we're finding they don't come. But once we get people to come once, they're more likely to return to us. So if we can just encourage everyone to take up that first breast screening, they'll see how quick, easy and painless it is and keep returning to us, basically. So if you can help us send that message out to the community, we'd be grateful. There is something you could do for us as GPs. Screening is a well-woman service. We've seen a lot of people presenting to us symptomatically. Basically, they've been told, or they tell us they've been told by their GP to give screening a call if they found a lump or have pain. That isn't the right pathway, and we won't see these people, so we will refer them back to you. So please, if any patient is presenting with a symptom, they should be referred to a one-stop clinic. They should be seen within 2 weeks. It's a lot faster and a lot less stress for the patient. We have the family history clinics. I think Emma touched upon these. So we have a moderate family history, and these e-referrals need to go to the family history clinic at Southmead for all those between 40 and 59 with a strong family history. We also, as the National Breast Screening Programme, screen the very high-risk clients. These do require referral from genetics or BAR directly to us. So please send them to those areas rather than directly to us. And then if they're eligible, we will screen them annually and include in an MRI as well. So yeah, how you can help us in future. We do contact your practice managers when we're due to invite your practice for breast screening. So please link in with the practice manager and promote our breast screening when your practice is due. Send a text to your patients notifying them that they will shortly be receiving an invitation to routine breast screening, but please check with us first so we can confirm your practice is about to be invited. Set up a text template to send as a prompt to non-responders. We can give you a list of non-responders and help you forward in with your text. And we have got a few more direct lines to speak to practices now, but the more up-to-date information we have with telephone numbers and emails, then you're more likely to get contact from us prior to us inviting your practice, basically. So just let us know. And we're always happy to have a conversation with you as well. And why do we do it? Well, early detection saves lives. In the last 10 years, Avon Breast Screening has screened 437,102 residents of BNSSG and detected 4,150 breast cancers that before they were too small to see or feel. So we would like to work with practices and community groups to ensure that we are giving our communities the best chance of accessing their breast screening appointments. Thank you for listening. And there's just some links there, which we'll send through. And if you need to contact us, we're happy to have a conversation with you. Thank you.
Really helpful oversight and some really important messages, particularly highlighted around sort of patients with symptomatic breast symptoms who should be coming through GP to be referred on, not directed to screening.
Yeah, thank you.
It's 2 o'clock. The time's flown. Thank you very much for coming today. I don't know if you want to pop the email address that was on your last slide into the chat, then people will have that saved, and if they've got any questions around breast screening, they can contact you directly through that. I don't know if there's any last questions for Emma. I'm happy to stay around for another 5-10 minutes, but I'm aware lots of people will need to leave because it is 2 o'clock. But like I say, if there are questions, do feel free to ask us. And those of us that can stay will stay.
Yes, the link is above that Roger put there for the feedback as well for this session. So
there was some feedback within there around sort of teaching self-examination. I put a couple of links to resources there, whether it'd be helpful to have a session actually just taking people through sort of self-examination just to feel more confident. That's something we can certainly look at doing, Emma.
Yes, yeah, and I think, was it then actually if you're in contact with a person to how to examine them? I think was that around. I think I saw something there, which again wouldn't necessarily be our domain, but we can happily support.
Yeah,
and we do a lot around
show us how to examine chests. Okay.
Yeah, around sort of the suggestion to maybe wear a separate top and bottoms, and the professional will want to examine you, but you can ask for a chaperone, or make it as comfortable as possible. So we do a lot around that appointment messaging.
Yeah. So Teresa, the training hub with Lily Dixon do run some sort of intimate examination training sessions. So those were initially open to paramedics, but that remit has broadened, and that was to teach sort of non-GP roles working in primary care how to confidently examine breasts, as well as sort of rectal examination and things as well. So that might be something to look into. I don't know, Roger, if we've got more of those training sessions planned.
Somebody else has just commented
okay, yeah,
on
Sarah's
that.
put that there. Yeah.
Yeah.
I look to Roger and I look to Lily to ask what's planned.
Something's coming up. If you have a look on our website, you can see all the events coming up. There's an events calendar on there.
Okay. So it sounds like there may be more intimate examination coming up, and there's a thumbs up from Sarah in the quality of that teaching. So that's great to see. And there's also popped in the chat around how patients sort of catch up on screening if they've missed that, and that's contacting Avon Breast Screening directly. Thank you for replying. As our numbers are dropping down, so we're down to 23 people. So if there aren't any other questions at just past 2. So nothing there yet, so keep looking. Hope if you get the BNSSG Training Hub, do send out sort of summaries of sort of upcoming events and things that are happening. So it's worth subscribing to that if you don't already. Then you'll see when these things are coming up, rather than having to think, oh, have I checked? Is that happening?
I'm making a note, Glenda, that we check on the intimate examinations if there's any more coming up.
And we can send that out.
Yeah.
Okay. Do you want to stop the recording now?
Thank you, Roger. Yeah.
Be great. Thank you, Roger.
I think people are just doing the
feedback.
The feedback form.